Next, I wanted to share my interview with Chief Medical Executive for the state of Michigan, Natasha Bagdasarian. We spoke this week about vaccine policy, the hepatitis B vaccine, and what the ACIP changes to recommendations mean for you and your family. The interview originally aired on my other show, In Michigan. It's a daily show where I dive into Michigan issues. Here is our discussion.
Hepatitis B is a virus that is transmitted through blood and bodily fluids. And so people often think that it is a sexually transmitted infection, but it is not just a sexually transmitted infection. It can be actually transmitted by very small amounts of blood and bodily fluids, and it can survive on surfaces. So it can potentially be passed along in other types of household transmission. If you happen to be clipping your fingernails, and you nick them a little bit, there are lots of ways that hepatitis B can be transmitted that's not sexual. And what it does, it attacks the liver. And so people who end up with chronic hepatitis B infection can end up with diseases like cirrhosis, liver failure, liver cancer. So it can be a really devastating virus. As an infectious disease doctor, I have seen many people, many patients. I've taken care of many patients with cirrhosis and end-stage liver disease, and it's terrible. And what is particularly concerning about hepatitis B is that it's much riskier for babies than it is for adults. So when an adult gets hepatitis B, it can sometimes progress to chronic hepatitis B. But if a baby gets hepatitis B at birth, there's a 90% chance that they'll have the infection for their whole life, and then could get things like cirrhosis or those other complications that I described. So babies are particularly vulnerable. And the reason we have a universal hepatitis B dose is for a couple things. Number one, we don't have a perfect healthcare system. So there are a lot of pregnant moms out there who don't get tested for hepatitis B. There are also cases where people's results fall through the cracks, things get misreported, they don't get reported to the right hospital system. And again, people fall through the cracks. Not just that, but you can also have exposure through other means. So if you are cutting your baby's fingernails, that could be another route of exposure from somebody else in the household. And it's not just people in your household. A lot of babies go to caregivers, they go to daycares, they go to a nanny's house for their first few months. And so there can be other places where they could get exposed. And since we've had this hepatitis B birth dose, we've had a dramatic decline in hepatitis B cases. When that birth dose is given in the first 24 hours of life, it's between 75% to 95% in preventing infections. And, sometimes I think for people, they need to hear stories about this more so than just hearing the data. We just posted some information about a case in 1999 here in Michigan where a baby died of fulminant hepatitis B at 3 months of age because there was a misreporting of lab results, and they didn't know that the mom had hepatitis B. And that's the other thing about hepatitis B, is that many people have hepatitis B and don't have any signs or symptoms. So you could be carrying hepatitis B without really knowing.
What happened once that newborn dose started to be mandated?
Rates declined dramatically, but it's still not a perfect system. So there are still babies who end up with hepatitis B, even with this universal birth dose. And I'm not saying that to mean to say the vaccine is not effective. I'm describing this because I want folks to understand that we have such an imperfect system. There are so many people out there who have hepatitis B who don't know they have it. So right now in the United States, 1 to 2 million people have hepatitis B. 30% of infected people don't know how they got it. So there is still so much hepatitis B out there. And it still happens, but the number of babies getting hepatitis B has declined dramatically since that birth dose was recommended.
And I think that there's this misconception that so many people are anti vax. I think that more often than not, at least in my observation, people just want the best for their child. And I think that vaccine hesitancy tends to bleed over into that. Do you agree with that? And do you see it the same way?
I think you're absolutely right. When people are making decisions about their babies, their children, everyone wants to make the right decision. No one is trying to be difficult. No one is making a political statement. People really want to do the right thing. But there's a lot of misinformation out there. And I think what's been really damaging recently is that we've been getting misinformation from folks who are in trusted positions of power. And that's really concerning. I think that one of the things we've got to really think about is that there is still trust. So we are losing trust in government agencies, we're losing trust in public health agencies, but there is still trust in your physician, your nurse, your local pastor. There's still a lot of trust in the people that you know who are in your community. And so we've got to get good information to those trusted messengers so that they can start having conversations. Because again, everyone wants to make the right decision for their child, for the person that they care about most in this world. And I think we're failing as a nation if we're not getting that good information out there in a way that people can really understand and digest.
I'm seeing a lot of TikToks, I'm seeing a lot of Instagram reels, and I see very often I see people who are promoting something, whether it is a new health product or whatever it is. But sometimes the information that they tend to portray or communicate doesn't necessarily end up being factually correct. I'm wondering if you are seeing that as well.
I think people assume that everyone is trying to make a buck. And when I'm talking to the general public, when I'm giving talks, one of the things I often will say at the beginning is I don't take any money from big pharma. I don't take any money from vaccine manufacturers. Because I think a lot of folks just assume that everyone is in it to make a buck. And not only am I not making any money from vaccines, um, and neither is anyone at the Department of Health and Human Services, but I'm sorry, the Michigan Department of Health and Human Services in our state. But when I talk to pediatricians, pediatricians are not turning a profit on vaccines. They're actually, a lot of times, it ends up costing more to administer the vaccines than what they're being reimbursed. So I think, yes, asking if people are what their motivations are is really important when you're taking medical advice. There are a lot of people out there who are online who are selling bioidentical hormones or the latest protein supplement or a new smoothie. And if people are profiting from that, then yes, can you believe them? So I think identifying who is a trusted source of information, who's not in it for a profit, is really important.
And now I want to talk a little bit about MAHA. And we're seeing the Trump administration do a lot or do away with vaccine recommendations. We're seeing RFK Jr. go in and change health policy, even though he has no medical background to contend with. I just want to talk just about this movement, right? Because, administrations don't last forever and no administration lasts forever, right? Like the Trump administration is going to end at some point. But this movement, this MAHA, Make America Healthy Again, this movement is not going to go away. And so I'm wondering just like, how do you see us moving forward? Like, do you think that this will ever get better? People will start to trust institutions more?
Not anytime soon. I think the damage that has been done is going to last for decades. I think the damage that's been done to the CDC and organizations like and groups like ACIP, I think that damage is going to last for decades. And I think it'll take a lot of work to rebuild some of these public institutions. So again, that's where we've got to really think about those local trusted voices and how do we leverage those. But eventually, yes, we do need like a source of truth. We do need someone who can give us national recommendations that are unbiased, that are grounded in facts. And what's ironic about the term MAHA is I want to make America healthy again. That is literally what I want to do. It's just that I think that terminology has been taken and is being used for something that's different. And if I can just give you like just one anecdote, I was at a meeting today on vaccines that got really contentious, and there were a lot of people sort of questioning the science behind any vaccine. And after that meeting, someone came up to me and said, she was a little bit older, and she said, I remember having measles and it was horrible. And my mom thought I was going to die. And I also remember how my mom and other mothers would line up to get their kids vaccinated against polio because it was so terrifying. I think a lot of folks out there just don't have that context. They don't remember how truly devastating these illnesses were. I was at an event at the University of Michigan School of Public Health to celebrate the development of the polio vaccine. And at that meeting, they had folks that they called polio pioneers, and they were in their 80s now, but they had been children who were in the first polio trials at the University of Michigan. And one of the polio pioneers told me the day that the polio vaccine was announced, church bells church bells tolled around the country, and mothers sat by their radios and wept because they were so overcome with emotion. Because every summer, mothers had been terrified that their kids were going to get polio. Every summer, there'd be huge surges in polio cases, and you didn't know if your kid was going to end up in an iron lung. We've got to share those stories. We've got to tell people what we are at risk of losing. We have been able to create a country and communities that have been relatively free of diseases like measles. Why do we want to not offer those same protections to our kids? We got those vaccines when we were kids. In many cases, our parents got those vaccines. Why do we want to take that away from our kids? Why do we want to take that safety away? I want to make America healthy again. I'm just thinking about it a little bit differently.
We just came out of a pandemic, and I think that you saw a lot of mistrust, a lot of vaccine hesitancy with COVID-19. And the interesting thing, right, with all of these vaccines that people are hesitant to get now, I think that you are almost seeing a situation, right, where we could have another pandemic, God forbid.
Oh, absolutely not. The world is a much smaller place than it once was. You can cross the globe, in a day. And so, yeah, the chances of viruses crossing and coming to our shores are much greater than they've ever been before. And it's really it's sad for me to look at our vaccination rates and how our childhood vaccination rates just plummeted at the beginning of the COVID pandemic and never recovered. um, I'm an infectious disease doctor. And at the beginning of the pandemic, I thought, well, one good thing that can come out of this is that people will understand how devastating these infectious diseases are, and everyone will get vaccinated, and everyone will, do what they need to do to stay safe. And we saw the opposite happen. So yeah, it is really ironic. The COVID vaccines were a scientific wonder. They were just the greatest leap forward in our scientific understanding that we could make vaccines and turn them around that quickly. It was amazing to see. And this was the Trump administration who led this. They really moved this process forward and got those vaccines out there. And so it was really interesting to sort of see how the vaccine then became politically unfavorable. Um, But I think what happened with the COVID vaccine did trickle over and affect some of our feelings about other vaccines. And I think part of it goes back to messaging. So when the COVID vaccine came out, there was a lot of excitement, and people thought, that's it. This is going to stop COVID. COVID is going away. This vaccine will make COVID go away. And I don't think that folks messaged correctly, nor did we really have all of the information there at the time that this, like the flu vaccine, it will attenuate your symptoms. So you won't end up, perhaps you won't end up in the emergency room or the hospital or the ICU, and it can prevent death, but it might not prevent milder cases of COVID. And I don't think that that was messaged very effectively. I think we still struggle with that messaging around flu vaccine. I think people don't understand that, number one, there are 200 other virus subtypes that circulate in the winter time. And so not every virus you get is the flu, and that the flu vaccine isn't going to prevent against mild cases. And I think we did such a poor job of messaging around that with COVID that the stench, the odor around that impacted other vaccines.
I know we've talked a lot about the pessimism around what is going to what this is going to look like in 5-10 years or more, and that it might not repair itself for decades. I'm wondering if you have, or what your solutions would be to how we can remedy this situation.
I think the more we talk about this topic, the better. I think some of us have stopped talking about things that are politically sensitive, and vaccines now seems like a politically sensitive topic. It really shouldn't be. This is just a routine health care issue. It's something that really impacts our families. We should be able to talk about this issue. And I think the other part of this that I want to just remind folks is that, again, I think everyone wants to make the best decisions for their kids. No one is coming at this from a place where they want to hurt their kids or they want to make the wrong decision for their kids. It's just that people don't know what the right decision is. And I think that we need to have more conversations, more dialogue, the way you and I are sitting down and talking about vaccines for, a nice big chunk of time. I think we've got to do that more often. People are interested in this topic, but they don't know who to believe. They don't know which set of data or facts to believe. I think we've got to be able to share our stories and share actual data from our state to really help guide people.
Thank you for watching and listening to this week's episode. I can't promise regular episodes for now, but we will be back on a regular schedule in January. For now, In Michigan is airing daily, and I'll see you over there on Monday.